County News will focus its next hot topics on counties and the opioid abuse epidemic. To set the stage, Charles Taylor interviewed the White House's top drug policy official, Michael Botticelli. You can see the full interview in the February 22nd online edition of County News.
We know that about 4/5 of newer users to heroin started by misusing prescription pain medications. So, this is really an epidemic that has two dimensions to it, but really has its foundation in prescription drug misuse issues. Rural parts of the United States, many of them have lacked some of the health and particularly the treatment infrastructure that exists in other parts of the United States. So one of our goals is to look at how do we continue to increase prevention efforts at the rural and local level, but also build on our treatment infrastructure to make sure that people in those communities have access to good evidence-based treatment. So, and on the public health side, there are a number of federal resources that support prevention programs. So our office administers, it's called the Drug-Free Communities Program. And these are locally based, locally driven programs to look at implementing community-based prevention programs. One of the biggest sources of treatment funding is through Health and Human Services. It's called the Substance Abuse Prevention and Treatment Block Grant. And these are formulas that go out to every state to look at supporting a whole host of prevention and treatment related services at the state and local level. And clearly states have an obligation to look at how they are aligning those resources with significantly impacted communities and parts of the country. I'm also happy to say that just this past summer, Health and Human Services announced $100 million to support our community health centers, because we know that many parts of the country, and particularly rural parts of the country, might not have access to a substance abuse treatment program, but have a community health center. And that's a really good opportunity to look at how do we increase access, particularly in those parts of the country that haven't had access to treatment. The other pieces that we can't understate is the role that the Affordable Care Act plays. So we know that many people are not able to access treatment because they haven't had insurance coverage before. And the Affordable Care Act mandates that those marketplace plans, Medicaid expansion plans, have a dedicated substance use treatment benefit to it. So, clearly, we have opportunities here to not only expand coverage for treatment, but to really expand our treatment infrastructure into parts of the country that we know are impacted, but that haven't had access to those kinds of programs before.